Earlier, you learned that some people fear infection and therefore hesitate to help others in medical emergencies. The diseases of most concern are those transmitted through blood and other body fluids. These are hepatitis B and C and the human immunodeficiency virus, or HIV. As an emergency responder, you can greatly reduce infection risk by applying barriers. Barriers include gloves, ventilation shields, ventilation masks, face masks, and eye shields. Gloves and ventilation shields or masks are useful during CPR. Gloves, face masks, and eye shields are useful barriers when exposed to body fluids such as blood. As important as they are, however, do not delay emergency patient care if barriers are not available. Research has shown that the chance of disease transmission is very rare when providing CPR. Nevertheless, you can minimize the risk of infection by always placing a barrier between you and the body fluids of the injured or ill person. Like scene assessment, barrier use is a skill that usually comes before you start helping the patient. Remember to begin with Skill 1, Scene Assessment. Stop, think, and then act. As you are assessing the scene, put on gloves if you have them. Put the gloves on carefully to avoid tearing. Removing your gloves once you have finished treating a patient is a bit more involved. Your objective is to remove them so that you don't spray or spread body fluids. To remove the first soiled glove, carefully pinch the outside portion of the glove at the wrist, like this. Next, gently roll the glove off so that the outside portion is turned inside. Hold the removed glove with the gloved hand, like this. To remove the remaining glove, place the ungloved hand under the glove at the wrist, next to the skin, and roll off in the same manner. To finish, roll this second glove off and around the previously removed glove, like this. Finally, place the gloves in a biohazard bag for disposal according to local guidelines. Your instructor will show you how to use one or more of the different ventilation shields or masks available. These barriers trap or isolate you from moisture or fluids from the patient's breath and mouth during the rescue breathing step of CPR. Barriers take up little room, so it's easy to keep a set handy at all times. But remember, the chance of disease transmission is very rare when providing CPR. The risk of infection may be even lower if you're helping someone who has a medical history you know, like a family member. Therefore, you may not need to withhold aid just because you don't have a barrier.